Welcome to my channel Mind Can Move. So this video is specially made for general doctors. Any moment a psychiatrist may encounter this sort of problem or general doctor. This situation is consistent with intake of psychotropic medications. With this video, I want to promote the concept of shared care policy. That is, shared care is that the care of a psychiatry is shared with general doctors.
Until the government is able to provide the universal health care, it is very important for the public to know they have to find a suitable doctor who is a private general practitioner living nearby. The private doctor lives locally, he knows the area, he knows the community, and also he knows the family very well.
The care of a psychiatry is shared with general doctors. And I suppose all the general doctors, those who are watching this video, will be greatly benefited. So here I am coming with the case. This patient was getting antipsychotics. She has developed some very unique symptoms. Now I am telling what are the symptoms. She has developed the symptom. She has tremor, she had bradykinesia, she had sialorrhea, she had restlessness, that is the psychomotor restlessness. The restlessness have two components. One is psychological restlessness and one is her motor restlessness. Both psychological and motor, that we call psychomotor restlessness. I will show you how her symptoms are and how these symptoms can be controlled within seconds. So now I am going to ask her to walk. You can see how she is walking. You just notice her gait. She has become rigid. See how she is walking. You notice her posture. You see her hands. You notice how she is holding her hands as if she has been dipped in wax. Her whole body has become rigid. She is having tremor. You see how she is trembling. You see her face. This is one of the most commonest side effects of psychotropic medications that we encounter in our day-to-day life. I am releasing this video especially for the general doctors and doctors of other specialty, because you see psychiatrists are very less number. These are very common symptoms and these symptoms are encountered by general doctors. So I am going to show you how we can relieve these symptoms. Actually this is what we call EPS, extrapyramidal symptoms induced by antipsychotics, and to be precise, this is a case of dystonia, and I'm going to show you how we can treat dystonia within seconds. This is injection promethazine. So I already have loaded. So I'm injecting. She will give some cough because this dystonia also induces laryngospasm. So first her laryngospasm will be relieved. This video is specially made to explain the condition of dystonia. So this is very common with antipsychotic medications. They may develop these sorts of dystonic symptoms. Akathisia. We can see Parkinsonian symptoms. Sometimes we call it Parkinson-like symptoms. Initially she was very rigid, now she is no more rigid. Now her tremor is subsided by a single shot of injection promethazine. So I am inspiring primary healthcare providers, those who are working in sub-centers, FRUs or any other government hospitals, or general doctors, those who are practicing in their locality, that they may encounter these problems of dystonia. That most of the patients, after developing these symptoms, they discontinue medications out of fear, because sometimes this dystonia may present with so severe ways, so dangerous way. There may be neck deviation, oculogyric crisis, stiffness, and all these symptoms. The patient and the patient's attendants, they perceive these symptoms to be so dangerous, and they become so terrified that after developing these symptoms, they discontinue medication. And if the patient discontinue medication, then he or she will again relapse and end up with very serious form of psychosis. So first of all, nothing to be worried. This is very much common and easy to treat. Now, even if we were very cautious, she was already been given medications to avoid these sorts of presentation. Now there are lot other antipsychotics, though those are costly, they are having very less propensity to cause these sorts of dystonia. So to be precise, she was getting risperidone combined with trihexyphenidyl. Now we will go to some other antipsychotics, those who are having less propensity to cause dystonia. Say for example, what I have planned is that I'll be going with quetiapine. But to be precise, for all of you knowledge, I want to reveal one fact is that even if I have seen the patients developing EPS with quetiapine, but still I will give a try. Now I will switch over. And this video is released with informed consent for the patient party. Good. Thank you very much, dear all, dear friends, dear colleagues. If you find this video to be beneficial for the society, please like this video and do not forget to leave a comment. Please subscribe my channel and share for the benefit of the society. Thank you very much.